Hi, this is Debbie. It is 12:02, so we'll go ahead and get started on attendance. All right, and today is the first day of summer. Happy summer, everyone. I don't know about you, but we're on a heat wave, 112.
Oh, wow.
Phoenix. Okay. I think when everyone announces their name, they should say what the temperature is where they are. In honor of the first day of summer, right?
Uh-huh.
All right. Well, I've got, this is our monthly meeting, and it's being recorded for Uniting Nursing Homes and Tribal Excellence. And this is our June meeting. We always meet the third Thursday of the month. Larissa, we're being recorded, right?
Yes,
we are.
Okay, great. Just wanted to check. So this call is being recorded. Attendance, I will put my name. All right. I know it's a little weird when can't see our hands being raised, but we'll try it. So just start talking, and I'll start writing.
Keith from HSAG, and it's currently 102 degrees in Phoenix.
Thank you, Keith. Something to look forward to coming home.
This is Ron Ross, Native American Health Management. In Lincoln, Nebraska, it's nice at 75 because we're getting rain, but it's been 95. So.
All right. Let's just get the break.
Hi, this is Teresa Holt, long-term care ombudsman in Alaska, and you should all come here at 60 degrees.
60 degrees. Woo-hoo. Teresa, you win for the first day of summer so far. We'll go with the lowest. I wish I had a prize I could send you over the phone. Anyone else?
Sally Hutton from the Colville Tribe, and it's 85 degrees here in Washington State.
All right. And you're more on the eastern side, correct?
Yes, yeah, we are.
Mm-hmm. And I know, Sally, we're going to let you talk and tell us what's happening in your world because I know you tried to come really hard to our annual meeting last year. So I'm really glad you're on the call. All right. Mm-hmm. Anyone else?
This is Shelley Silstrot, and it's about 65 degrees here as well, so cold.
Yeah, and Shelley, you're in Seattle, right?
Today I'm not. I'm up at home in my home, which is right on the Canadian border.
Okay.
Town called Clinton.
Okay, very good. All right. Anyone else?
Hi, this is Melissa Castaneda. And I'm also in Anchorage, so right around 60 degrees. We're, with Teresa, same area.
Good. So, and we're going to give Melissa a chance to introduce herself. We spoke yesterday. Melissa is basically taking over the program that Melissa Heflin had, and so she's going to be talking a little bit about that work. So thank you, Melissa, for being on the call. Okay, and next?
Teresa from Laguna in New Mexico.
Oh, nice. Okay. Teresa, remind me your last name.
Williams.
And you're the administrator?
Yes.
Excellent. Nice. Glad you're on the call. Excellent.
Thank you.
We're going to have to get Teresa, I don't know, Jill or Larissa, if we have her email, but we need to make sure she's on the Unite listserv, okay? All right. Anyone else? Oh, Joseph Ray, yay, Joseph. Oh, what's your temperature in Mexico?
Still cooler than yours, probably.
Okay. Right.
About 90.
90, okay. Not bad. Handle that. Anyone else?
Elizabeth Thompson, ombudsman. I don't know.
Elizabeth is here at Archie Hendricks, and I know her, so thank you, Elizabeth. Our ombudsman. All right, anyone else?
This is Jonathan Collins from Kaufman and Associates.
Okay, Jonathan. And Jonathan, you're in Washington, D.C., I always forget.
Yes, I am.
All right.
It's about 82 degrees.
Oh, not bad. Okay.
Hi, this is Larissa McLennan from Kaufman, and it is 82 degrees as well.
Okay, you're in Washington too, right, Larissa?
Washington, D.C., yes.
You're in Washington State.
No, D.C.
You are, okay. Well, hopefully we'll get to see you guys when we're there. That's awesome. Anyone else? All right, so I have Debbie, Keith, Ron, Teresa, Sally, Shelley, Melissa, Teresa Williams, Joseph Ray, Elizabeth Jose, Jonathan, and Larissa from KAI. Does that sound correct? All right. All right, I am going to follow our standing agenda, if I can find it amongst all my paperwork here, so that we don't get too far off track. We'll try to get done before an hour is over if possible. But we do have a lot to talk about as far as some upcoming webinars, and we've got some new people on the call, so I want them to have a chance also to say what they want to say. So, oh, here it is. I found it. Okay, so we've got 2 new members, and we'd like them to introduce themselves, or 2 people that aren't always on the call. So, actually 3. So, Sally Hutton, would you like to tell us a little bit about your world?
Sure. We're a tribally owned. We own facility is a 44-bed skilled facility here just north of Grand Coulee Dam. If anybody knows where Grand Coulee Dam is, we're usually about 75% full. We right now are having to use agency aides for 4 full-time positions. We were just able to hire another RN, but we don't have the 16-hour of RN coverage. We've got 12-hour of RN coverage. Just wondering if everybody else is out there having staffing issues as far as CNAs and nurses. But other than that, we're doing good.
Excellent. Okay, and I think we have talked about that. That might be a really good non-clinical topic or clinical topic for next year, because we always pick one for the year. So, good. And Melissa Castaneda from Anchorage, you want to just give us a little update on your world?
Sure. Good morning, everyone. So I am the Elder and Youth Program Manager for the Alaska Native Tribal Health Consortium, or ANTHC. ANTHC is a consortium of the 229 tribes within the state of Alaska. And so what my program does is provide volunteers to our elders who are referred to our program. So these elders may have lived in the village and may have to receive care and move into Anchorage to get the care they need. And so what I do is help with the volunteer aspect of visiting, but also cultural luncheons and a few other events throughout the year. So thank you.
Where were you before? Have you always been in Anchorage, or?
Oh, I was born and raised in Kotzebue, Alaska. Kotzebue is 30 miles above the Arctic Circle. So if you were to look at a map, it's between Point Hope and Nome. And so roughly a third of Alaska is above the Arctic Circle. So what I tell folks is I'm fairly southern Arctic Circle area. So that's my background. Yeah.
Well, thank you, Melissa. We're so happy you're here. You're still pretty north for me, but I get it. And let's say, how about Teresa Williams? Could you talk for us a little bit and tell us about your work?
Yeah, most of you know Sheila Wiggins, who was the administrator here before me. We're a 58-bed nursing home on the Laguna tribal land. And we also have a senior center that we operate through grant funding for home-delivered meals as well as congregate meals activities and health promotions. So we got quite a little bit of work out here, too. Just as a comment, I didn't get the first speaker's name, but, yeah, we are in a agency situation as well for both aides, and we're desperately short for RNs right now. So, yeah, we're in the same boat.
Okay, and we will... thank you, Teresa. Sally, that's Sally Hutton, Hutton. The list of tribal nursing homes has been fairly recently updated, and it's on CMS.gov. But, Jonathan, if you want to make a note, we might want to send that out again to everyone, just, as a courtesy. And then you guys can connect, maybe. If you guys want to connect, you'll have each other's contact information. If there are any discrepancies on that, please let us know, because Teresa emailed me since our last meeting, Teresa Holt, and said that their contact information was actually incorrect, their fax and their phone numbers, so we had to get that straightened out. So, just double check that list and make sure what's on there is correct. If not, please let me know, and I will follow up with KAI. So I think everyone else has been on these calls at least once or twice, so if I missed anyone, I apologize. Just interrupt me. If there's any changes in contact information, it's really important that the sooner I know, right now we don't really have a co-lead. We're working on that. Actually, we do. Tammy Reed from Morningstar has agreed to co-lead until our annual meeting when we can try to find someone to co-lead for next year. So Tammy Reed right now is kind of the backup to me if you can't get a hold of me. So everything I'm sending out, I'm CCing Tammy on that. And just so you know, Carly is no longer with Morningstar, but there's a new social worker there named Ina, and I believe that Ina will be coming to our annual meeting in August. So you'll get a chance to meet Ina. Old business, we do not have a guest speaker today, by the way, but just quickly on old business, we did have a steering committee call May 14th, which again is always the second Monday, and that was Dr. Winchester, Julie Cahoon from KAI, Larissa from KAI, Ron Ross, and Mike Harris. Ron, he also works with you, correct?
He sure does.
Okay, he was on the call. Val Crail was on the call. And Val, there's a new social worker, and I don't know if any of you know her, Karen Kyler. Does anyone know Karen?
No.
Okay. I believe that she's with Val's group. I think she's with Val's group. And I did hear from Marcella Wilson, who's the DON, where Val Crail is, and she's thinking about the annual meeting also. So in case you hadn't heard, the GWAP, the Geriatric Workforce Enhancement Program, which used to be called the Geriatric Education Center, there's one with Dr. Jordan Lewis in Anchorage and one at the University of Arizona that I participate with. Those were, at least ours was extended for 1 year through June of 2019. So that's good news for us. And as long as they get their funding, they're willing to help us with our annual meeting. So really cross your fingers about that because we'll have to make some kind of payment by July 30th, and the new contract would start July 1st. So I'm kind of working with the University of Arizona to see when they get the funding and hoping that that comes through. So we'll talk about that in a little bit. There was some connection with Dr. Winchester and Landella Bluehouse from NICOA, did a presentation at AGS, the Geriatric Society, so that was good. We talked about trauma-informed care as a possible clinical topic for 2019 because of the CMS regulations. Let's see if there's anything else. Ron talked about financial sustainability, so we appreciate all his expertise and the handling of Medicaid by state. So we did some talk on that. And then we had our monthly meeting was May 17th. And some of you, that was a very small call, and I think partly because we had a lot of other stuff. We had the webinar that we hosted on cultural humility May 23rd, plus we had our steering call on the 14th. So the call on the 17th was very, very quiet. It was just myself and Larissa and Joseph. So I'm thankful that they called in, but it was a very small call. But we did get a lot accomplished, and we talked about some points that we might want to discuss for our meeting in Washington, D.C. in August. So I have that information, and let's see. We'll go over that in just a minute about our annual meeting, okay? Because we do need to pick an actual topic for our PowerPoint presentation, so hopefully you can all provide some good feedback on that. All right. So do we have no one from NICOA is on the call, or NCAI or NIHB? Okay. Keith, do you want to give us a little QIO update on what's happening? I'm sorry I missed the webinar, but our surveyors are in the building, so I couldn't get away.
I think that's an understandable reason, Debbie. But our webinars, they're recorded, so you can always go on our event site and find those. We've got two major initiatives going on for the QIO program with nursing homes, both of which we've been doing for a while. So one is our statewide collaborative, and so every single state does this. So if you don't know your QIO, definitely go to QIOprogram.org, I believe, and you can find your state's QIO. But every state has a nursing home collaborative, which educates nursing homes on improving quality measures, reducing those scores, implementing QAPI, and helping to reduce antipsychotic medication use. So that collaborative officially ends on September 30th. So definitely use the time between now and September 30th to get on board with that. But there should be a time after September also to reach out to your QIO and get technical assistance. But just so you know, that collaborative will end officially at the end of September. The other major task we're working on in every single state is our CDIF initiative, where we're having nursing homes enter their data into the National Healthcare Safety Network, which is a Centers for Disease Control and Prevention database. And so we actually have a baseline rate completed from 2017, and that includes about at least 15% of the nation's nursing homes. So there was more than 3,000 nursing homes participating in this. And so this year we're continuing the data entry, but we're doing our best to help people understand how to pull the data, how to analyze it. Even if you have zero, it's still a great thing to be able to report to your partners. So we're learning a lot through that program, and NHSN is also one of these things that can help prop up the antibiotic stewardship program, because monitoring and surveillance is a huge part of that. And it's a free service. So if you are interested in signing up for NHSN, anybody who has a skilled facility is eligible for it. And again, the QIOs have a lot of resources out there. So if you have any issues signing up for it, we have resources to help you get through that. Just kind of understand that program a little bit better. So that initiative runs through the end of this year, and then will be due by January 25th for us. So that's when we're going to be completing that project. So those are our two major initiatives. And I know Debbie's been working hard with us on both of those, so we really appreciate her participation in that.
Keith, I had a question. You said the CDIF initiative ends when?
We're collecting data through December of this year.
Okay. Okay.
And also just so people know, we do have some national data. So what we have for our baseline nationally was about 0.66 C. diff infections per 10,000 resident days. I don't know the other states' baseline rates, but I can tell you Arizona's was 1.8 C. diff infections per 10,000 resident days. So in our state, with our cohort, we're about 3 times the national average. So we're looking into the data and see how we can best help with that too. So again, contact your QIO. They've got that kind of data, and it really can help you benchmark where you stand among your peers.
Yes, and I just want to comment on that. Last week I was in Minneapolis for the APIC conference, which is the Association for Professionals in Infection Control, and I will see if I can get a couple of the PowerPoints from that and send it to KAI for all of you to have. But they really focused on antibiotic stewardship, healthcare-acquired infections, environmental control for C. diff especially, and so there's a lot of best practices. There were quite a few of the state surveyors there. In fact, I met quite a few of them. I got a chance to tell them about our collaborative.
Cool.
So there was actually quite a few surveyors there. I just met this morning with our federal surveyors from San Francisco Region 9, and they wanted to know specifically about antibiotic stewardship. And so, Keith, I wanted to tell you, I did, show them my monthly report where I document our C. diff rate and NHSN, and so I think they were fairly impressed with that. So, yeah, it's worth it.
That's really
it takes time, but it's worth it to do this. And it's sometimes you feel like you're just wading through data and it's never going to end, but, it does start to kind of make sense after a while. So I think it's worth the plunge in. I really do. Sorry, I hope I didn't interrupt you. I'm bad about talking. Okay.
I'm glad to hear Keith for there.
Yeah, thank you, though, Keith. I'm so glad you're on the call. And Keith was actually at our annual meeting here, too, last year, which is great. Teresa, you want to give us, you and Elizabeth, could you give us a quick ombudsman report or update? Either one of you. Elizabeth or Teresa Holt, do you guys have any updates from ombudsman point of view?
Sorry, I was trying to get off mute.
That's okay, no problem.
I think probably one of the bigger things that's going on right now with the ombudsman world is really looking at these discharge notices. So some states are overwhelmed with discharge notices. So nursing facilities are supposed to send discharge notices for all facility-initiated discharges to both the resident and the ombudsman. And then some states, like our state, we are not actually getting discharge notices. So it kind of goes both ways. But it's really a protection for the resident so that they know their rights and they know if they want to appeal that decision, how they can do that. So that's probably the biggest thing I can think of.
Okay. So there is an appeal process.
There is an appeal process. So if you know, I guess the difference between a resident-initiated discharge and a facility-initiated discharge is a resident, you know, maybe gets injured, has a stroke, falls, breaks their hip or something, and their goal has always been to go home. When they get well, they're like, you know, they can't get out of the facility fast enough. Versus a facility discharge, which would be any other situation. So maybe the resident is on Medicare and the Medicare is over and they have to leave, or any other of the discharge reasons. Those would be facility initiated. And so they're supposed to give notice both to the resident, and if the resident isn't competent, then to their legal representative, and then also to the ombudsman. And it's different in every state. In Alaska, they send it to the state ombudsman's office. In other states, they might send it to their local ombudsman.
Okay. Elizabeth, are you on the call? Do you know how we're doing it here in Arizona?
No, not at this time. I haven't really had a discharge. The only thing that was mentioned at our meeting yesterday, I think, was that to notify me when you're doing the surveyors. I think that's what you're supposed to notify me, so I can at least show up at one of the days just to see what they're doing.
Okay.
That was only the one thing that was mentioned, but for the discharges, I know there's some changes, but I haven't had one yet. I mean.
Okay, you haven't seen any of those discharge reports?
Yes.
Okay. Does anyone have any questions for Teresa or Elizabeth on that process? Anyone dealing with that, administrators especially?
No.
No. Okay. Sally, you're not doing that. Are you sending them out?
We haven't had any facility-initiated discharges.
Okay. So is facility-initiated, Teresa, like let's say they fell and had to go to the hospital and then didn't come back. Would that be facility-initiated?
No, my interpretation was, say they hadn't paid yet, did a 30-day eviction notice, or something occurred where you're telling them that they're being discharged from the facility.
Okay.
But I don't know. It's
kind of like they don't really want to go, but we're telling them they have to go, kind of thing.
Right.
It's more like
that's why they would be appealing, and yeah.
Okay.
Right. So facility-initiated discharges, actually, facilities are also supposed to let the ombudsman know. I think it's supposed to be like on a monthly basis of all transfers to the hospital and transfers back. And if somebody transfers to the hospital and they are not coming back, the facility still has to do a 30-day notice, discharge notice. So, and facility initiated or resident initiated is really a resident requesting to leave. Anything else is facility initiated. So if you're telling the resident they need to leave and they say okay, that's still facility initiated.
Okay.
So it doesn't have to do with, because what happens is a lot of times residents don't know that they can say, I don't want to go, or I'm not ready to go.
Okay.
And especially with our Alaska Native folks, sometimes they aren't going to say that. And so if somebody tells them what their rights are and that they have the right to appeal, and, you know, maybe they just feel like they need more PT or they need more days, or so it's not always a contentious situation.
Okay.
And Teresa, can you talk a little bit to this? I don't know if this probably doesn't happen or may not happen in Alaska, but I know that one of the times that irreputable facilities will get a client that manage, and since they're, you know, they may be physically in pretty good shape, but they're difficult clients, so they'll try to discharge them to get an easier to manage client for the same amount of money. And I think that's sort of one of the reasons that this really was called to the attention of the people who are making the rules, because they just, you know, if you've got a sweet little old lady versus a grumpy old guy, one's probably easier to manage than the other. So they try to get rid of the grumpy old guy and accept the sweet little old lady.
Okay.
Right.
Okay, so
that happens often.
Yeah.
Okay.
And for non tribally owned nursing homes, they're very often looking at source of pay. So people will get discharged if they're on Medicare, or if they run out of money, they'll get discharged. And technically, you can't do that until they haven't paid for a month. So anyway.
Okay.
What about the issue? Sorry, this is Sally from.
Go ahead.
Okay, Sally from Colville Tribe. The issues of admission, so because we've had some clients where they're trying to, local and surrounding bigger hospitals are trying to have us admit people that have obvious behavior issues and are going to need even one-on-one, and we're just saying that we're not able to meet that patient's needs, and they're just calling repeatedly. We thought we had taken care of the issue, and here they're calling again yesterday saying, can you take this patient?
Well, so everybody who is admitted to a nursing facility, is the referring facility is supposed to complete a PASAR.
Right.
And I can't remember what the PASAR stands for, but it's supposed to identify anyone who has a developmental disability or a mental illness.
Mm-hmm.
And it's a screen, and it has two levels. So the first level is, do they have one of those? And then the second level is, if they do, what services are needed to be provided for that resident? And at that point, I think nursing facilities have a hard time providing psychiatric services.
Mm-hmm.
But it's my understanding that you can't discriminate against people who have psychiatric disabilities in your admission process. But you have to be able to care for all the people who are in your facility. So I don't really know.
Okay. Does anyone have any information on that specifically?
Well, this is Shelley, and I think that any facility anywhere is going to do an assessment. If they can't provide care for an individual, I think it would be silly to accept them. So I don't believe that that's an issue. The issue comes when you do accept them, decide you can do better. You know, everybody has a client that they've accepted into their facility and discovers that their care needs are higher than what they anticipated and can't do it, and work with them to try to transition into a facility that can provide that level of care.
Okay.
But the issue comes when you just decide, Teresa's nicer, so I'd rather have her here, so I'm going to get rid of, Joe, who's my problem.
Okay.
And
yes.
and Joe does have recourse.
Okay.
So this is Teresa. I would say that if you have someone like that in your facility, it's worthwhile to contact the ombudsman to help resolve that. So in Alaska, I have to say that our tribal facilities are very good. I mean, they take all the people in their tribe that come to them.
Mm-hmm.
They don't screen out anyone. But then they also call us, and we work really hard to find a way to get resources to them so that they're able to serve some of the more difficult residents. And in our state, it tends to be specifically people with dementia who have significant behaviors. And so we've worked really hard to help them get training and to learn some of the techniques, like, for example, Teepa Snow stuff in dealing with people who have assaultive behaviors. A little harder when it comes to someone who's bringing drugs and alcohol into the facility and drinking and threatening staff. That's a little harder.
Mm-hmm. Okay. And by the way, just so you know, our federal surveyors just this morning, she asked me about that, like what training was I doing to deal with, what do they call it? There's a name for that. It's in the regs, but, you know, it's basically not just that you're identifying any abuse, but what are you doing to make sure these patients are cared for, you know, in terms of almost like the trauma-informed care piece a little bit, you know, the de-escalation strategies like we talked about, compassion fatigue with the caregiver. She was looking for that kind of answer. You know, what are you doing to make sure that your residents are safe? So that did come up just this morning, the surveyor. So, okay, very good. We're going to go ahead and move on, so thank you. I don't think Lisa Johnson is on the call, and I know she can't come to our annual meeting, so I'm sad about that, but she did let me know about that. Can we get a little report from KAI, Jonathan and Larissa?
Hey, Debbie. This is Jonathan. So we are in the process of, we got approval from CMS for the the last best practices report, one on financial stability. So we're going to be finalizing that and getting it posted to the website in the coming weeks. We do need to discuss the upcoming webinar as well as the next round of best practice reports. We want to iron out a topic today so that we can go ahead and get moving forward on that. I know that when we last talked on the standing committee call, you wanted to wait until this meeting to come up with the topic for the report.
Okay, so we do need a lot of feedback on that. We need to, so just to clarify, July 25th is the second LTSS webinar that we'll be hosting on financial sustainability. We have our speakers. We're going to get some printed information from Leo Litsky. He agreed to do that, but otherwise, I don't have the list in front of me, but we do have the speakers for that. The best practice report, we interviewed, 5 people, right?
Yes.
5 people were interviewed, and that will come out on this next week, which is great. So we have one more best practice report, or 2 more yet?
Just one for this contract
one
series.
More. Right. So we've done 2 on, let's see, what have we done so far? 1 on cultural humility, 1 on financial sustainability so far this year, and what was the other one? Was that the disaster one?
Disaster preparedness, yes.
Right, okay. Right, so we need to pick, usually we have our clinical and non-clinical topics, so usually we do 2 on each, but we had kind of deviated and done 1 on disaster preparedness. So I don't know, those of you who are on the call, if you could just kind of speak up and help us think about what that final best practice report could be. Because KAI, usually they interview some of our folks and then kind of put that together into a report format and post it on cms.gov. So we could break down the cultural humility piece a little bit more. We could talk about one aspect, like, Medicaid, enhanced Medicaid reimbursement. We could just pick one, area of financial sustainability. We could talk about staffing shortages, although I think that's almost a topic in and of itself. So does anyone have any thoughts on that, on that topic for the next best practice report?
What, like survey preparedness or new survey issues or most common or prevalent citations or like the fines, the monetary fines, or people getting those or?
That's a thought. I mean, that's a thought with, yeah.
Joseph here. Just quick input from our last discussion that we had a couple weeks ago. The trend of younger people coming to our facilities with such as here at Laguna, for instance, we've had younger people with who were quadriplegics. A person who was quadriplegic and another person that was a younger man with DD, developmental disability.
Yep.
And again, where does that fit in the nursing home world? Because of the lack of services that we have here at Laguna, these persons, not only Laguna, but throughout Indian country, because one of the gentlemen was a non-Laguna member. He came from another tribe, a close tribe. Again, that's coming up more and more, which I'm sure it has in the past, but we just seem to be trending upward in that category of residents in our facility. And so if you could add that to possible topics.
That should be a good, on the disability and the younger population, might be good, Jonathan, to do a best practice report. And the reason I say that is because when we go to Washington, D.C. to the Title VI conference and we present on tribal nursing homes, Joseph is going to specifically talk about disability during our presentation. So, Joseph, this might give you something to, work with, too, if we did some interviewing prior to that. What do you think?
Thank you. Sure, that will work.
You know what I mean? Because you could pull some stuff from the best practice report, too. And maybe we could poll our nursing homes, our tribal nursing homes, and get some data, and that would be helpful, too, on those that are maybe younger, kind of average age. Have some numbers to put out there, too, if possible, if that's okay. I think that might be good.
I'll go back and do a little research because I know that I believe there's some best practices maybe already on the website. Maybe Jonathan knows about that already, or someone else is aware of that topic being discussed already or being already out there.
Okay.
But yeah, we need to definitely, again, we need to revisit it, I think. Thank you.
Okay. All right. Is everyone else okay with that? Are you all okay with maybe just kind of focusing our next best practice report on what Joseph was just talking about? I think the CMS regs is also a good idea, but with our annual meeting coming up, this might be something that would fit in with that.
Yeah, this is Sally from Caldwell Tribe, and yeah, definitely that's always been an aspect of our facility. We've always had younger clients here. We currently have a DD patient here that's been here since 1987. We've had numerous different quads in the facility. We currently have a 23-year-old female quad, and we also have had a high number of young end-stage liver patients. We had a 34-year-old pass away here with end-stage liver a few years back. I also worked with the Navajo tribe back in the early 90s for 3 years, and we had several young quads down there when I was working there also.
Okay. Yeah, I would say it's pretty relevant. Anybody else thoughts on that topic?
So this is Teresa again. I just wanted to say we're doing a lot of work in Alaska, not necessarily with the tribal nursing homes, but just in general, because the DD population is actually living much, much longer. It used to be very rare that they would live beyond 50. And so we're seeing lots and lots of individuals as part of the silver tsunami. We're seeing lots and lots of facilities getting people with developmental disabilities who are aging, so are 60, 70, 80, and so they're the right age to be in a facility, and they have those issues, but they also have the aging issues, but they also have developmental disabilities. And I think there's a fair amount of information out there about working with people with developmental disabilities.
Yep.
So
okay.
we're seeing many more calls for people with developmental disabilities.
Okay. Yep, I appreciate that.
Thank you for that, Teresa. I think where I see my where we could focus again for our staff that maybe has not had exposure to that population. Just again, having something for our trainers to have at their something to use as a tool, as a resource for new staff. Again, that's where my thought goes around this. And then just as ongoing, unfortunately, there's, that trend as you said, and it's going to be people with disabilities are 20 up to 25% of the population. So yes, our facilities will need to have that knowledge about how to interact and administer services. Thank you.
Okay. So I think, Jonathan, that's probably your answer. On the best practice report, was there something else that we needed to do on?
I would like to know who would be willing to be interviewed for that topic, even on this call specifically.
So, Sally, would you or Joseph or Teresa Holt, either any of you, be willing to be interviewed?
Sure.
Yes.
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 Okay.
This is Teresa, yeah.
Okay. I think the ombudsman. Elizabeth, are you still on the call?
Yes, I'm here.
Would you be willing to be interviewed on that topic?
No.
Okay.
No.
All right. It's okay to say no. Is there anyone else on the call today that would be willing to be interviewed on that topic? Jonathan, I'm wondering if we might reach out to Tammy. I know we've kind of bugged her a couple times, but I think we could do that. And possibly maybe one of the other administrators, like Val, we can double check with them. Let me know. I can bug Rick. I can bug probably Rick or Rosie too if I need to.
Debbie, this is Joseph. Excuse me. Also, the gentleman that we had on our webinar a few weeks back.
Yeah, Jordan Lewis.
The other doctor.
Oh, Henderson, or no, Gary. Okay, I know who you're talking about.
Yeah, he has some background in disability.
Okay.
Maybe we can reach out to him.
Absolutely. Thank you,
Okay.
Joseph. So we're getting kind of running out of time a little bit, but I do want to talk about our annual meeting. It's super important. So again, keep the financial sustainability webinar on your radar screen for July 25th. We have our speakers. We do need to make sure that everyone sends their bios and picture for that. And then also our annual meeting, we have our webinar speakers for Wednesday mornings, August 15th. So those folks also will need to send their bios and pictures. So we have to get that pretty quickly. I'd like to, if any administrator on the call would like to give a brief update onto what's happening in their world, this would be your moment. Anyone? You guys talked a little bit.
Joseph, I want to welcome Teresa Williams to the group. She's back with our facility after Sheila transitioned out. So we're hoping that, welcome back to the group, Teresa. We hope you can participate more in the future. Teresa Williams at Laguna Rainbow.
Thank you. And I just wanted to report that we just had our annual survey and they left on Monday night. So we're in the middle of that recovery.
Yeah, okay. Yeah, okay, got it. Okay, that's good to know. So, all right. Are there any tribal assisted livings on the call today? Anyone from a tribal assisted living facility? All right. Again, I would really encourage you to go to cms.gov if you haven't recently and look at some of the information there under Education and Outreach and then American Indian Alaska Native. You'll see some of the Tribal Technical Advisory Group and our website. So don't forget to be checking that. Let's talk briefly now about our annual meeting. So I just wanted to say that, okay, we are going to be part of the Title VI Administration on Community Living's 40th anniversary conference. So that is going to be at the Marriott Marquis in Washington, D.C., and it will be Monday, Tuesday, Wednesday, Thursday, August 13th, 14th, 15th, and 16th. So that obviously is coming up fairly quickly. We are going to have our annual meeting on Tuesday night. Now, we've always had a dinner meeting. This will be our 4th annual meeting. You know, depending on how many people RSVP, and right now we're about 15 people that I know of that have said they were going to come. In the past, we've gone higher than that, but I'm not sure that we have the funds this year to do a whole dinner, depending on how many people RSVP. So we'd really like to have an RSVP, you know, for sure by the middle of July, if you could really kind of think about this and make some decisions, because we would have to put the University of Arizona, if they get the funding, can give us $1,000. And I got some quotes from the Marriott Marquis. The dinner would probably be more than that. If they give us a room, we can get a room because we're there for the conference, so that's good. We don't have to pay for the room. But they could do like appetizers, you know, and more of a just drinks and appetizers, depending how many people, and that would probably fit better into our budget. So I wanted to ask you all what you wanted to do about that. If there's a facility out there that would like to put out maybe an extra $500, I think we could go with the dinner. But I'm just not convinced right now, depending how many people come, that we'll be able to do that. Right now we have the room booked from 6 to 9 on Tuesday night, and then we will do a presentation on Wednesday morning, August 15th at 0900. We're on the draft agenda for that. And then Wednesday afternoon, we're setting up some meetings on Capitol Hill. So I've been working on reaching out to some Congress people to see if we can meet with them on that Wednesday afternoon. So I know that's fairly ambitious, but I think it's we've had several meetings now to talk about this. And the areas that are coming out for advocacy are just general understanding of long-term support service and what we do. The asking for, like, if we apply for a grant to get their support, that's another thing. And then, Ron, if you want to talk a little bit about the Medicaid and also just getting funding for long-term support service. Okay, so those are kind of the areas, those are our asks, those are our things that we'll spell out and come to the table with.
Yeah, this is Ron.
Yeah.
So our company will put $500 towards the dinner.
Oh, wonderful. Awesome. All right. Thank you.
You're welcome. And I have 5 minutes, and then I've got a 3 o'clock I have to jump on. So
that's okay. Give us a little update on anything you want to say.
Well, I can tell you that we're getting more facilities and potential facilities out there. You know, we're talking to the Kickapoo tribe down in Texas, and they're exploring wanting to do a nursing home. And then there are 3 tribes up in North Dakota that we're talking to about them wanting to start a nursing home. And then we're visiting with another facility in South Dakota who has a facility, but they haven't opened it, and they're trying to figure out how to pay for it. And so it really is a lot of just working with the different states. You know, some states are more savvy into how to help tribal facilities. You know, we're going to be working with the state of Arizona to try to get their recognition of paying a higher Medicaid rate. And it's a journey, you know, it's a marathon. It's not a sprint, and it just takes time. But there's movement out there that other tribes are interested in figuring out how to start a nursing home. And then, of course, the key to that is how to limit the tribal subsidy in order to provide a decent nursing home. So there's work in that area.
Okay, and that's exactly what we want to be talking about. Even though Ron talks about a state level, we know that states and feds communicate. So we want to put our word out there, right? We want to make sure that we've got our message really clear. So thank you, Ron. That's a very generous offer with the dinner. So it looks like we will have a dinner Tuesday night. Now, I want to ask one more question before we get off the call, and that is the format. What do you guys want? A lot of, I mean, in the past, we've kind of had a formal PowerPoint presentation and different things, and that gets expensive to have all that equipment in the meeting room. So I'm wondering if we want to have a little more relaxed format this year and really give people a chance to talk and really kind of form this collaborative a little more strongly in relationships and things like that. What do you guys think about that for our meeting, for the meeting time that we'll have on Tuesday night?
Well, I think the more relaxed it is and people can just get to know each other and what they're doing and best practices and how we can work together, I think that's probably the best thing the collaboratives can do at this time.
Okay.
I also think that the meeting that I attended where we talked, or where somebody gave a presentation about their own facility and just talked it through, really was a spurred conversation, because everybody, you know, wanted to ask questions, and then they started talking amongst themselves. So if we're going to have a lot of new people, that might not be a bad plan.
Okay. Okay, that sounds fine. We might end up having more like a printed information that we can talk from. Someone could do a presentation without a formal PowerPoint, but I'll see what we end up being able to afford. Okay. I'm wondering how much things I can fit into my suitcase and bring myself. Okay. Anyone else? Any thoughts on our annual meeting, Tuesday night, August 14th?
Debbie, this is Joseph. Why don't we invite someone that's Washington, D.C. based to come speak to our group?
Ooh, nice. Okay.
Like with National Indian Health Board or NCAI or... Oh, and I'm sorry. You had asked if there was anybody from NCAI on the call. I can't recall who our contact was at NCAI. It might need to be updated. They've had some transition recently. Okay. And then just a suggestion from Dr. Rubidoux, former IHS director.
Okay.
I spoke with her in Kansas City at the NCAI midyear a few weeks ago. She wants us to would like us to invite ourselves for a tour of the NCAI facility, offices, and Policy Research Center while we're in D.C.
All right. Awesome.
Yeah, I can do that. My role, just FYI for the group, my role with NCAI and the National Congress of American Indians is the Disability Subcommittee Chair, and we're part of the organization there. So again, I work closely with the Elders Subcommittee also.
Excellent. That's excellent. Okay. So that's really exciting. So it looks like not only will we have a tour of NCAI, the Policy Research Center, but we'll also have some advocacy work. So we'll get it scheduled together, Joseph. You'll have to give me a time and I'll work around that, okay? I'll see when I can pick meetings up. So this is going to be a really exciting annual meeting. I'm really looking forward to it. If you can at all come, I'd really encourage you to. There's no cost for the conference. It's just the hotel and your flight. So I'd really encourage you to come. It's always fun. We don't see each other a lot. These phone meetings are great, but it's really nice when we get together. So please just see if you can come, invite other people, and we'll make this work, okay? All right, it's 12:59. Anyone else? Any other last-minute comments or thoughts? Announcements?
Debbie, this is Jonathan. I have something for you, but it can wait till everyone else gets off the call.
Okay, I'll stay on, Jonathan. Thank you.
Okay.
All right, thank you. So for our steering committee, it will be July 9th, and then our July meeting will be the 19th. So 9 and 19 for July. Thank you all.
Okay, bye-bye. Have a good day.
Bye. Thanks, Jelly, for being on the call. Appreciate that.
Hi, this is Alan. That command cannot be used at this point. That command cannot be used at this point.
I'm still on, Joseph.
To record a message, press 5.
Uh-oh. Somebody's
For more information, press star.
Just real quick, I did speak to somebody with the that foundation that you sent me the email about.
Yep.
They have a Washington office also.
Okay.
So those were some of the persons I was thinking of inviting to our meeting to come speak to us about what they do, and if there's a possible collaboration. They want a little bit of information from us, of course, but I think we fit into their mission.
Okay. What did she tell me to? What was it? I can't remember.
It was that Native American Foundation.
Okay, yes. Okay, yeah. Okay.
Do you recall that one?
Yeah, I'm going to have to go back to my emails, though. And do you have a name that I could follow up with, or do you want to follow up? Or
well, yeah, I called their Colorado office because they said they also have or they show that they also have an Albuquerque office, but they're just getting up and running in Albuquerque.
Okay.
Hold on. I have the email here. Just a second. If you could just bear with me just for a sec. First Nation?
Yeah,
First Nation.
Okay.
So anyway, like I said, I think we have some possible speakers for our meeting. And so.
Good. So do you want to text me the name or email, or what do you want? How do you want to do that?
Yes, I'll do. I have in my notes.
Yeah.
In front of me, I have a name, and I'll get that. I'll forward you that info. So.
Because then I can see. Let you know. Yeah.
That's all I have to say. I was just going to say. So.
Okay. What's the doctor's? Can you spell her name for me again? Indian Health Service. You had the doctor.
The former Indian Health Service Director, Dr. Yvette Roubidou.
Yvette Y-P.
Roudideux. I don't know how to spell that last view.
Oh, okay, got it. Roubidou.
Yeah.
Okay. Yep.
That's Roubidou.
Okay.
Yeah.
Okay. Okay. Yeah, no, that's awesome because I'm thinking let's see what we can set up, late morning, early afternoon as far as meetings, and then we could go to over there maybe toward the end of the day, like 3 o'clock or something. If that's not too late, you need to let me know. Get me a time that we can tour that.
I'll make some calls in a few minutes and email follow up. Kind of late in the day over there, but so I'll work on that one.
All right, and once I identify 3 or 4 or 5 different senators or representatives, can I just text you their names and state, and you tell me if you know them or think that might be a good idea?
Definitely.
I got an updated book. I ordered it where it gives, like, for each congressional session, it gives you all the senators and reps and what state and what committees they're on. So I'm just kind of going through that and picking out some key people, and then I'll send it to you. And you tell me what you think, and then I'll contact their office.
Sounds good.
Okay. All right. Thanks, Joseph. Thank you.
Thank you, too. Take
All
care.
right.
Bye-bye.
Okay.
Debbie, you still there?
Oh, sounds like she hung up, John.
She hung up. Okay, I'll have to give her a call then.
Yeah, so thanks again for all your help, Jonathan. It sounds like we got something planned good for DC, and,
Yeah,
keep
I'm
going
looking forward
forward.
to seeing everybody.
Yep.
That's what. All right, you have a good one.
I'll talk to you soon.
Okay.
Hey, have you gone to any baseball games up there at the Team Nationals, or?
I have. Earlier in the season, I went. I haven't lately.
There you go. We're trying to plan a fun activity too for our group too. So that was my suggestion, but Debbie wasn't too responsive to that one. So anyway, I'll talk to you soon.
Okay.
Thanks.
All
Take
right.
care.
Bye-bye. You too. Bye-bye.